This is Dr. Leah Olson at the Clover Clinic, and today I'm interviewing Dr. Seth Burrell, and he's going to tell us about the very important cardiovascular disease imaging technique that he does, which is just a sneak peek into what is going on in your body. So, Dr. Seth, thank you for coming in.
Thank you for having me.
Yeah. So for my first question, is just in general, what would be a good description of the imaging technique that you provide here?
So what we do is we look at the carotid artery,
Mm-hmm.
and we can tell if there's plaque there. We can also see if there's thickening in that carotid artery. And that's a major blood vessel running your neck here, and it's one of the easiest places that we can actually see with ultrasound. And that's just sound waves going into your body and giving us an image. It's very commonly done, it's non-invasive, and very cost-effective. The only other way to see these plaques or the thickening of the blood vessel is by doing an angiogram, which is where they put a camera actually into your artery, very invasive, or they use a CAT scan to see if there's any calcified plaque around the heart, or in the heart blood vessels, the coronary blood vessels, and that can miss soft plaque. So it's a very good way to see.
And of course CT has that added
Radiation exposure.
Right, and
Exactly.
this doesn't.
No radiation, just sound waves.
Right.
Non-invasive.
Good. So who benefits from this test?
So anybody that has high cholesterol, they're inflamed, they've had joint replacements, if they've smoked or if they ever smoked, they have abnormal cholesterol, like low HDL, the good cholesterol, or high LDL, the bad cholesterol. If they're sedentary, overweight, obese, if they have any relatives that have had heart attacks or strokes at a younger age. Those are people that can really use this test because they might have plaque. And that's really what we want to find out. If they don't have plaque, we're going to measure that actual thickness, which is the precursor to plaque. The thicker that blood vessel lining is actually lipid pools accumulating in that underneath the endothelium, which is the lining of the blood vessel. And you can tell, you can predict that they'll have some type of cardiovascular event if that is overly thickened for their age. So many people can benefit from this, considering that heart disease is the #1 killer of Americans.
Right.
And being that way, we could screen so many people, especially also since sudden cardiac arrest or heart attack, resulting in the stopping of your heart beating, is often the first symptom or sign of heart disease. So who's this test really useful for? It's for a lot of people that don't know their current status of heart disease, considering they're more likely to die of heart disease than anything else.
Right.
And we can catch them before they go on to have heart disease.
Right, and you mentioned about the vascular age testing.
So that's what this is. When we scan you, or anybody in general, and we don't see plaque, what we do then is we take images of the lining of the blood vessel, and then we measure how thick that is. As we age, we're expected to get thicker in that blood vessel lining. If that is thicker beyond your age, so for example, let's say that I have a 50-year-old that comes in for this test and their blood vessel lining measures to be that thickness, that thickness we would expect for a 70-year-old, then they would have a very increased risk of having a heart attack or strokes at some time in their life.
Right.
Just because we can see that thickening is premature for their age.
And it's great to catch that before any kind of event.
Right.
I know that this is very near and dear to my heart because my dad died of a heart attack, very sudden. And if we can prevent that, it's very important. It's very amazingly beneficial. I think that this test is a good motivator as well. Can you give me a couple examples, or maybe an example?
Yeah. So a really good example of a case was a younger female in her 30s, early 30s, and she had 3 kids. She was a marathon runner, and the only cardiac risk factor that cardiovascular disease risk factor that she had was that her father had a heart attack at the age of 52. And what they found in her was actually a small plaque. if you have plaque already established in your blood vessels, you are considered at high risk for a lifetime event of a stroke or heart attack. So you ask the question, who should be tested? A lot of people, especially because women seem to be, our traditional method of assessing cardiovascular risk is not catching enough women. And that's one complaint of what's called the Framingham calculator. And that's the traditional method of calculating somebody's 10-year risk for cardiovascular disease. This test is calculating somebody's lifetime risk. And so that one case really illustrates how one person you would think would not have any cardiovascular disease because they're so young and they're so active actually has it. And you can catch that then before she goes on to develop a heart attack in her 50s or 60s. And treating it now is much easier than treating that heart attack or congestive heart failure.
Yeah.
Much easier to treat this now.
Totally. Yeah. And it's much easier, in my line of work, I see a lot of strokes and traumatic brain injuries, things that happen after the fact. There's not much you can do with a dead part of the brain, but there's a whole lot you can do if you catch it before that.
Absolutely.
So, so we have a question from a patient. He says, I'm over 300 pounds, and I know I have high cholesterol with my regular blood tests. He didn't mention this, he's also diabetic. What can your test tell me that might influence my actual treatment choices?
Sure. So he's got, that sounds like 3 risk factors there. He's diabetic, overweight, and has abnormal cholesterol. So his risk for cardiovascular disease is probably high, but how high? What percentile does he fit into for his carotid artery thickness? He's how old?
He's mid-50s.
So mid-50s. Maybe he has the blood vessels of a 70 or 80-year-old. Maybe he's that thick. Maybe he already has plaque. We don't know the answers to that. I've caught several people that have never had any signs or symptoms of cardiovascular disease. And I go in and I look, they're not overweight, they're not obese, they eat vegetarian, and I go in and I see marked plaque. Just their whole carotid arteries have tons of plaque, and they had no idea.
Right.
So I catch those people hopefully before they'll have a stroke or a heart attack, and they can get a bypass surgery at least before their heart completely dies, or they have a stroke and they get that dead tissue of the brain tissue dying.
Right.
So this is much. I would expect to see something abnormal in somebody that has 3 cardiac risk factors like that, and we could assess the type of treatments going forward based on that. If there isn't too much plaque, we can still be more aggressive with lifestyle choices, such as more aggressive diets, more aggressive medicines that can break down or even reverse plaque. And higher doses of fish oil can also help reverse or increase HDL, which is the kind of cholesterol that takes that plaque out of those blood vessels and takes it back to the liver to be processed.
Right.
So that's helpful too. So to answer the question, absolutely, this test, even though we would expect somebody to have a higher risk of cardiovascular disease with those findings, we can still see things that would tell us to be more aggressive. And we have many ways to be more aggressive.
And I know that when you imaged my carotid, I was very much thinking, okay, now if you find something, I'm going to up my exercise. I'm going to up my, I'm going to be a lot more motivated if you find something. So, so those choices, the lifestyle choices that are difficult, take some energy and they take some habitual changes. Would be a lot easier if you're motivated. It's the difference between, are you going to live until you're 90 or are you going to live a couple of years? Who knows, and so this is a sneak peek. I love that. So in addition to carotid artery testing or imaging, what else can you see?
Well, we can look at the aorta. The aorta is the major blood vessel that runs from your heart and then goes down and branches off to your arms, your head, to the carotids. It also goes down into your abdomen and then down to your legs. It splits and goes down to your legs. It's the main arterial source where blood's going through your body. And we look at that through the abdomen. And what we can tell from there is just to make sure, especially in the elderly population, that there's no aneurysm or ballooning of that blood vessel. If you've had a lifetime of improper mineral balance in your diet, not enough of one mineral or too much inflammation, you can have a breakdown in the integrity of the connective tissues of that blood vessel, and you can actually get it ballooning. It can expand beyond what it should. And so we can screen for that as well. And what I do more often in 70, 80, 90-year-olds is I look at the carotids to see if there's plaque that needs to be treated aggressively with a stent, perhaps, and I'll send them on to further evaluate that. I can also look at that at the abdominal aorta, that major blood vessel, and screen for an aneurysm, which is oftentimes not found until it's too late.
Right, and that's a major, very rapid, what's the word I'm thinking of?
Right.
Problem.
Yeah. It can be a problem that develops very quickly and have a very bad outcome.
Yeah.
Meaning you could die pretty quickly if it deteriorates rapidly.
Right. And also the thyroid.
Yeah, we can look at the thyroid. So your thyroid gland is right here, and a lot of people have heard of that, especially women. Hypothyroidism is an underperforming function of the thyroid. It's just not performing as well as we need it to. Well, when we're looking at the carotids, we're so close to the thyroid, and it's actually, we use the thyroid to get a landmark to know where the carotid is. So that major blood vessel, the carotid artery, is right there and right here. You have two of them, and then we look at the thyroid right in the middle of those, and we can see if there's bumps on those, we call nodules. We can see what kind of nodules there are, and if you might need to get a biopsy to also find something that could be potentially cancerous. And if it's too big or too small, we can look at that and then maybe do some simple blood tests to see if you need any thyroid medication or to eliminate certain foods from your diet that can cause hypothyroidism.
Perfect. And then you can also see things like the liver, right? The abdominal organs. So
when we do a abdominal aorta scan, we can also look at the liver. Now, in people that have cardiovascular disease, or we're screening for cardiovascular disease, and they're overweight, their cholesterol's high, their triglycerides also might be high. Those are also another form of fat that we see on blood tests. If those are high, it's almost a sure thing that they're going to have fat in their liver. And what do I mean by that? Fat is infiltrating pieces of liver tissue. And what we can do is look at the liver to see if there's diffuse or just spreading of fat in the liver. And that's a pretty simple way to just look and screen for fatty liver disease. And if you have that, like our patient we talked about before, 300 pounds, abnormal cholesterol, sedentary lifestyle, then in diabetes, it's almost assured that there's going to be fatty liver. I think the latest statistics I read about were up to 40% of the population have fatty liver. How many people out there are obese and overweight? How many people eat so many carbohydrates in their diet? A lot of those people have fatty liver.
Right.
And we can track that. So we can determine if you have fatty liver, and then we can track that as you get really good treatment and change your lifestyle, change your diet to see if that fat's leaving. We also have really good medicines to give to get that fat out of the liver as well.
Perfect. Another question I have from a patient, female patient. I am 54 years old with no family history of heart disease, but I just lost my good friend very unexpectedly to a heart attack. So do you think it would be good for me to check my carotids, or can I pretty much say I don't have high cholesterol or family history and be safe?
That brings up a lot of interesting points. She knows that she doesn't have any, what we call the traditional risk factors. Non-smoker, doesn't have diabetes, doesn't have hypertension. Her cholesterol labs came back as normal. She's not a smoker. However, I would be interested to see what other ways, there are other ways to look at cholesterol, like particle size of cholesterol. So if you have a volume of cholesterol, you get that lab back and it's say 200 or 150 milligrams per deciliter. That's a volume. But lipid particle size actually tells us how many cholesterol particles fill up that volume. Are you filling up a bucket are you filling up a bucket full of marbles or BBs? And that's related to particle size. If you have a bucket full of BBs, you have more particles than if you had a bucket full of marbles. And every BB, so there's more particles of like the BB size.
Right.
That's the way we think of that is that's just even more chance to cause endothelial dysfunction and to even cause endothelial inflammation and more chances of getting that cholesterol into the blood vessel lining to cause atherosclerosis or plaque.
So you could have normal cholesterol, but they're tiny little particles.
Exactly. So you could have a normal volume, but you could have an abundance of particles. You could have too many particles of that volume. And that's how we explain the fact that there are people that go on to have heart attacks because of atherosclerosis or plaque, but they've had normal cholesterols their whole life.
Right.
So finally we have this test that can tell us about how big the particles are. How many particles of cholesterol do you have? And that's turning out to be pretty important when it comes to answering that question. Why did that person have a heart attack, but their cholesterol was normal their whole life?
Right. And we can do that test in conjunction with ultrasound.
It kind of helps us complete the whole test, the whole cardiovascular screening test. So there's 3 components. There's that lipid particle sizing. Then we also have lab tests that can assess inflammation and chemicals that are out in the blood when there are plaques forming. We can look at those too. And then we answer the question. All those labs are there. Say somebody has high particles, a high number of small particles. They have inflammation. Are they forming plaque? Can we see now that they have plaque, or do they have thickening of their blood vessel lining? And that's what the CIMT does.
Right.
We can answer that question finally. Is it actually happening? The lab tests say that it is. Let's make sure it is.
Yeah, it's a great sneak peek into what is actually happening. So yeah, thank you so much. And I think that the blood test has a high coverage as far as insurance.
Yes.
And so that's on a lot of people's minds. Oh my gosh, how much is all this testing? It's invaluable.
Absolutely.
If you're, at risk of dying. We have one life to live here. So thank you so much for joining us
yes,
today.
thank you for having me.
Yeah. And so you can book an appointment with Dr. Seth Burrell, call the office, and we can set you up for that, and we can talk about it at your next visit. Thank you so much for joining us as well.